And joining me now to discuss this is Dr. Getty Anyawuke. She is an infectious disease specialist, and she joins me from Louisiana, US via Skype. Good to have you join us.
Happy to be here. Thank you for having me.
So Dr. Getty, Shanghai alone recorded about 2,678 cases on Saturday, and China as a whole recorded 4,500 cases. How do you explain this recent surge of cases in China?
Well, the recent surge, and it's not only in China, by the way. If you look at the United Kingdom, even here in the United States, they are having another slight increase of COVID. The Omicron variant, called the variant BA2, has shown itself to be more evasive also. It's more transmissible, and it's been infecting people. Remember that there's been a more relaxed attitude towards COVID now. I mean, there is COVID fatigue. It's been here now 2 years. In the medical side, we have more tools, so people tend not to be so on it as we were at the very beginning, which is understandable. Now we have more things to treat the COVID, or at least protect ourselves with COVID. And people are sometimes not doing the things that we used to do before. And that is showing up in stuff like this when we relax our guards.
And Dr. Getty, what do you make of this strategy of using swift lockdowns and aggressive restrictions to contain outbreaks, as against that in China, as against some countries that are learning to live with the virus?
So we remember a little history here. This stuff was first identified in China, and this was how China was effectively able to control the virus at that time. And even Taiwan was very, very restrictive, whereby anybody that came into the country had to be quarantined for 2 weeks. Well, they have started, relaxing those measures, and we're seeing what's happening. Versus in the other parts of the world, like the United States and in Europe, where people are now seeing that, you know what, we have tools that we can take care of this virus. We could be more relaxed. I guess time will tell us which system is better. But as they're having their own COVID surge, we're also having it over here. So that's food for thought.
So basically, no strategy is better. But what sort of local pandemic prevention and control methods, or epidemic prevention and control methods, do you think that countries should begin to adopt to ensure that we do not have this kind of surge in cases?
So let's just accept the fact that COVID is here to stay. And then what we should do is look at pathways of previous pandemics that we've had in the past. How did they behave? COVID-19 is an RNA virus. How do they behave? What's their pattern? You know, in 1918, we had the Spanish flu, and that took about a couple of years before it became really endemic. Is that the way COVID is going? Some of us are watching that closely. What we need to do is, where there is vaccination, people should get themselves vaccinated. I cannot overemphasize this. Yes, the virus mutates. Yes, the virus tries to evade the immune system. But it is better for you to have some antibodies protection than for you not to have any. Now, there are people that have been infected. I would say majority of the people that are infected will produce some form of antibodies, and that probably would depend on the severity of the person that got the infection. But they'll have some protection, but how long? So there are three things we should note, right? How long the protection lasts when we either get infected or get the vaccine. How much mutation is the virus doing progressively? And also, what are the things to treat? There is a very interesting study that was recently released about the previous coronavirus. It's known as 229K. That virus in 1980, they took the blood of the people that got it in 1980, and they took the blood of people that got it in 1990 and then 2000, and they checked. it looks like progressively, the antibodies that were produced in 1980 were not exactly the same like in 1990 and out of that. And what it is telling us is that these viruses keep changing because they have to survive. Remember, they cannot survive outside our cells. So they're smart. They're going to figure out a way to keep moving, and that's what we call the mutation. We, in my opinion, are at the end of the initial phase of this pandemic. And I think what we should watch out for is if we start having waves that are not as crazy as we had before, at a point, it will just be, it goes up a little, it comes down a little, it goes up a little. So it'll be kind of cyclical. And I think we should all get used to that and just get ourselves protected. And when we have symptoms, get into the doctor and get the treatment. Now in the US, we have 2 pills, viral medications that we can use. And I would just plug in here that the Association of Nigerian Physicians in the Americas, which I am a member of, we are going to be in Nigeria to do a medical mission. And COVID is one of the chief areas that we're going to be looking into.
And that will be interesting in terms of support to the health sector here in the country. Dr. Gatti, I wish we have enough time to talk about the cases here in Nigeria. We've not reported any in a while. I wish we could talk about what that means, but my time is up. Thank you so much for talking to us as always. Infectious disease specialist Dr. Gatti Ayaoke.